Burns are a common and serious injury, particularly in caregiving settings where vulnerable individuals may have impaired mobility or sensory functions. Caregivers must be equipped with knowledge on how to prevent burns and handle burn injuries effectively to minimize harm and ensure safety. This video provides essential burn safety tips for caregivers, focusing on prevention, first aid measures, and the importance of creating a safe environment. There are three main types of burns that caregivers should be familiar with, but let's start with first-degree burns. A first-degree burn is the mildest type. It affects only the outer layer of the skin. Symptoms include redness, mild pain, and swelling, but it typically heals within 7 to 10 days with minimal intervention. Second-degree burns are more serious. They affect both the outer skin layer and the layer underneath. These burns can cause blisters, severe pain, and swelling. While they can heal over 2 to 3 weeks, proper care is essential to prevent complications. Third-degree burns are the most severe. They affect all layers of the skin and can damage underlying muscles, nerves, and bones. These burns are often painless at first because they can destroy nerve endings. Immediate medical attention is crucial for third-degree burns. Prevention is always better than treatment, and there are many ways to reduce the risk of burns in your caregiving environment. Let's begin with kitchen safety. Always use the back burners when cooking, and make sure pot handles are turned inward, away from the edge, to avoid spills. Hot liquids and food should always be kept out of reach of those in your care who may have limited mobility or awareness. Be mindful of hot surfaces and appliances. Space heaters, irons, and stovetops should be kept away from individuals at risk of burns. Always check the temperature settings on items as well as hot beverages or food before use or consumption. In the bathroom, one of the biggest risks is hot water. Always check the water temperature before assisting with a bath or shower. The water should not exceed 100 degrees Fahrenheit or about 38 degrees Celsius to avoid scalding. Non-slip mats and shower chairs can also help prevent falls, so always keep precautions in mind. To ensure hot water safety, consider labeling hot water taps or using temperature-regulated water heaters. These simple steps can make a huge difference in preventing burns. Be cautious with electrical equipment near water to prevent burns. Regularly check cords and appliances for damage and always unplug them after use to avoid overheating and fire hazards. Even with the best precautions, accidents happen. So knowing how to treat a burn is equally important. Here are first aid tips on what to do and how to treat burns according to their severity. For a first-degree burn, the first step is to cool the burn immediately under cool running water for at least 10 minutes. If water isn't available, use a clean, cool compress. After cooling, apply aloe vera gel or a burn ointment to soothe the skin. Then add a sterile bandage or gauze to protect the area. Once that is done, all there is to do is to monitor for any signs of infection, such as increased redness, swelling, or pus. For second-degree burns, cool the burn under running water for 10 minutes as you would a first-degree burn, but don't pop any blisters. The blisters protect the skin underneath. After cooling, apply an antibiotic ointment to prevent infection and cover the burn with a clean non-stick bandage. Be sure to seek medical attention if the burn is large or does not improve within a few days. For third-degree burns, call 911 immediately. These burns are severe and require professional care. Do not attempt to remove clothing stuck to the burn. Instead, cover the burn with a clean cloth or sterile dressing to protect it from infection and monitor for shock. If the person shows signs of shock, such as rapid pulse, shallow breathing, confusion, lay them down with their feet elevated if possible, and keep them warm. Handling burn emergencies requires a calm, composed approach to ensure the safety and comfort of the person in your care. Let's walk through the key steps to manage burn victims safely. First, stay calm and reassuring. Burns can be painful and overwhelming, so it's essential to maintain your composure and provide comfort to the person in distress. Next, assess the severity of the burn. Quickly evaluate whether it's a minor burn that can be treated on site or a severe burn requiring emergency care. Look for signs like blistering, deep tissue damage, or burns covering large areas of the body. Follow first aid protocols. For minor burns, cool the area with cool running water for at least 10 minutes. Avoid ice as it can worsen the injury. For more severe burns, cover the area with a clean, dry cloth while waiting for medical assistance. And finally, seek medical help when necessary. For burns to sensitive areas like the face, hands, or genitals, or for third-degree burns, call emergency services immediately. Acting quickly can make a significant difference in recovery. After a burn incident, proper post-burn care is essential for healing and minimizing complications. Let's explore some key steps for recovery. First, ensure follow-up care. It's crucial for the individual to see a healthcare provider, especially for second and third degree burns, to monitor the healing process and address any concerns. Next, manage scars effectively. If scarring occurs, consider using silicone sheets or gel to reduce scar visibility and improve skin texture. Burns can be painful even after the initial incident. Pain management is key. Over-the-counter medications like ibuprofen or acetaminophen can help ease discomfort. Always consult with a healthcare provider if stronger pain relief is needed. For more severe burns, rehabilitation may be necessary. Physical therapy can help restore mobility, prevent stiffness, and ensure the individual regains full functionality. By handling burn emergencies with care and supporting recovery effectively, you play a critical role in ensuring the safety and well-being of those in your care. Knowledge, patience, and preparation are your best tools. Stay vigilant, stay safe, and always be ready to act. We at Devoted Care Services, LLC, thank all of you for your dedication to caregiving, and remember, proactive prevention and thoughtful care make all the difference.